Okay, well, good afternoon, everyone. Welcome to this month's Community Mental Health Transformation webinar. For those I don't know, I'm Alice. I work in the comms team at Sussex Partnership and support this programme of work with communications, and I'll be your host today, but we've got a great lineup of speakers who will be doing all the talking, really. So let me share my screen. I'll bring up a few slides and we'll kick off. So this. Okay, great. So before I get started, just to say that the webinar is being recorded today and added to our playlist. So if you prefer, then do keep your camera turned off and anonymise your name. To turn on live captions, click the three dots that say more in the toolbar of your screen and go to language and speech and select turn on live captions, and there'll be loads of time for questions and discussion at the end of the presentation. So just put your virtual hand up and get involved in the conversation. So as I say, we've got a great range of presenters joining us today. So Penny and Martin are going to give a bit of a central update of what's going on with the development of neighbourhood mental health teams. And then we've got a range of kind of representatives working across Sussex, working to mobilise neighbourhood mental health teams in East Sussex, Brighton and Hove and West Sussex. So we've got Mark and Paul, who are going to be providing an update for Brighton and Hove. We've got Fran, who's going to be providing an update in West Sussex, and Ian, Ricky and Glenn, who will be sharing what's going on in West Sussex. As you can see from the presenters, we've got a real mix of people from organisations, from NHS, from voluntary sector getting involved, which really does show the kind of the true collaborative nature of the development of neighbourhood mental health teams. So I'm going to hand over to Penny and Martin to give a central update with what's going on.
Penny, is it okay if I go first? Yeah, brilliant. Thank you. And thank you, Alice. Yeah, it is really exciting times, isn't it? I think we are about 7 weeks out and thinking about all those years of kind of work and dedication that really and effort people have really put in. It is really significant, isn't it? And it is really significant is because it's a brave new world, isn't it? It's about bringing partners and providers together to work into a very different way and to get a more sort of inclusive and integrated way for the actual better services that will be provided to people as well. So yeah, it is a really important time. So there will be kind of much activity, many things to do after November, but for right now, we are really focused on the things we must do running up into those next 7 weeks as well. So we have a really strong kind of leadership and management structure that we will be kind of further embedded into make sure that people really are kind of aware of what they do, what's their function, kind of, how they need to work differently into the future as well. And a part of that is actually kind of how we actually do work differently. So the meeting structures are really important to have in place to actually making sure that there's that safe transition, but actually kind of really does support that new way of integrated working as well. So kind of moving on kind of our list, we kind of got our standard operational policy procedure, which Penny is going to pick up and talk to much more in detail as well. But that's really our kind of how we work. So what's changed? How do we now kind of are going to be delivering neighbourhood mental health teams? Really, really important that staff really know what it is, how to work, kind of, what they need to do in processes and systems as well. So we're just finalising our service specification. That's really kind of what it is, what's our expectation and what's going to be delivered as well. Another really key document that's taken a lot of work, and we really are grateful for people being involved in that process as well, really describing how we're going to work differently, how it's really going to work. And then kind of going on to our collaboration agreement, as we're calling it. But this is in a sense our kind of partnership agreement. So as providers, how are we going to be delivering this as well? So some really key documents that can be worked on as well. I think we might have mentioned in the past around kind of our requirement around moving away from our kind of care plan approach or CPA approach as well. And now it's kind of, NHS England and kind of Penny and Tazia are kind of really starting to understand with much more clarity what's the expectation, what's new, and how we would be working different. So it'd be really good to bring that out to another meeting, but I just really want to refer to the work that's going on that as well. I think we really need to be clear about this new way of working, kind of how people access the services, what those processes are, what's going to change now and what's not going to change now, and what might change in the future as well. So we want that clarity about, for a GP or for people accessing the services, really clear about, oh, this is how I kind of access the support as well. So again, we're working really closely with comms and Alice around making sure that that's good messaging going out around that. And as we've mentioned before in other meetings, we're twinned with the kind of the new EPR System 1, as it's called, an integrated working kind of way of working on our kind of data systems as well. So we're really kind of making sure that that system's up and kind of ready, but also the staff are really kind of enabled, they're trained, they know how it works as well. So when 10th of kind of November, the new EPR system comes in and the new neighbourhoods at the same time, it's a really, really smooth process as well. So that's a bit of an overview, but there's much more details. Hopefully we're going to hear today as well. But I will kind of pass on to Penny, who's worked really kind of, diligently around the kind of SOP offer. Thanks, Penny.
Thank you, Martin. Just before we talk about the standard operating procedure, just to be really clear, it will be slightly different everywhere across East and Brighton as we move forward, because we didn't all start in the same place. What will be the same is the bringing together of resources in each of those areas to try and provide the same types of offer, both out in kind of primary care settings or in voluntary sector spaces, and also retaining that specialist mental health provision that's formerly been provided by SPFT in the form of those ATSs, or assessment and treatment services, and specialist older adult services. So we'll make sure all of our comms are really reflective of what's happening in each of those local areas. The biggest bit for us is really, this is the formal launch of us working very differently, trying to bring us all together, trying to work more collaboratively together, and trying to make that journey for people much more easy to navigate, with a lot more choice and a lot more information wherever we can do that. So as Martin has just said, we've just had our standard operating procedures signed off, so approved. Lots and lots of people were involved in the standard operating procedure, and again, a huge thank you for everyone involved. So we had experts by experience feedback, we had a variety of professionals, we had people from lots of different organisations, all bringing their expertise into a single space, and hence the standard operating procedures were born. We've just now sent those standard operating procedures out to everybody, and teams are starting to really look through them, double check there are things that everything's in there that is required, and there aren't things that are missing that would stop things going live, that might be a gap, might present any sort of risk. We don't think so, but we obviously want to go out and check that. So we've got a bit of time for a bit of a test run to make sure all those things are done and complete, because it really, as the slide said, describes that structured end-to-end journey for somebody. Talks about clear roles, responsibilities, safeguards, commitment to continuous improvement for us to continue to develop and work on those procedures. So they are out and about. We'll also go back to our league colleagues and speak and update about the standard operating procedures and tailor that paperwork down into something much more palatable, because it's quite long, and so we'll need something different for different audiences. So that's where we're at with the standard operating procedure. And just very briefly to mention the replacement of the care programme approach, we'll do an update perhaps next time in more detail, but we've had the second version from the national team about what that should look like in the future. It will be called the Personalised Care Framework, as we've talked about before. But what we have agreed is, within these standard operating procedures that we've had approved, those procedures reflect the standards of the new personalised care framework. There's some slight differences in there, and perhaps we can talk about that in more detail next time. But I'll ask Alice to send out a link to the new personalised care framework so people can see it, the national recommendation. So without much further ado, I'm really pleased that we have lots of colleagues across the organisation and across Sussex and across other organisations with us, because this is really what it's all about now. We've spent a lot of time really collaboratively working together, and now we're really keen to support places to be able to set up and get running in this new ways of working, and really enhancing all of the good work that they were already doing and formalizing some of that good work and bringing those ideas together. So I'll hand over, I think I'm handing over to Brighton first. Is that right, Alice?
Oh, did you want to just talk, just reference the
I'm
the
sorry.
name of neighbourhood mental health teams, and
I
then
will.
the three
Apologies.
functions that kind of that will replace the existing service name. So this is included in the SOP, but we thought it would be useful just to highlight it.
Thanks, Alice. Thank you for the reminder. So we will be single overarching neighbourhood mental health teams. So those 15 teams, and first and foremost, colleagues in those teams will be associated with that title. So, for example, it would be Hastings Neighbourhood Mental Health Team, or Worthing Neighbourhood Mental Health Team, or East Brighton Neighbourhood Mental Health Team, whichever the geography is. Within those neighbourhood mental health teams, we have three kind of core functions, and they are titled in this way just to really help people understand, staff really, as well as people using services, about what their roles and responsibilities are and how they work and function. So it isn't that they don't work interactively with each other, but it is really important that those three parts are also clearly understood. So the first one is primary care and partnerships, and that's really talking to the people out there in our GP practices, in our voluntary sector services, working as community connectors, social prescribers, Pathfinder if you're from West Sussex, all of those types of services, and how they then operate and what their responsibilities are, and how in the main people will remain with their GPs while they're in that element of the service and getting the right care and treatment they need that's proportionate to the needs that people are bringing. And then we've got the specialist adults function, which really is as described. It's as the old assessment and treatment and older adult specialist older adult assessments were. So it's bringing that clinical specialism that secondary care traditionally provided, really working together with primary care and partnerships, both to support them, but also to provide those more specialist clinical interventions that people may require. And the same for older adults. It was really important that we kept that older adults part as a recognition within itself. We've got one of the oldest populations in the country, and we really recognise that specialism and how much it is needed within our neighbourhood mental health teams. But all of those functions will work together and come together, and as somebody coming into services should be able to access any part of those functions, no matter where they kind of first hit those services, without the need for us to take things away. People have to be referred in, have to have a whole new assessment, etc. So it's really bringing together all of those things in one space, but still recognising we need the three functions to be recognised. The other reason we need those functions split in this way is so we can really understand where the bottlenecks are, where the demand is, where we need more of something, so we can then really start to plan ahead about what we might need and where we need to concentrate as we move into the future and we begin to work more and more and more in this way. So if you start to hear those titles, that's why. And you'll see under people's staff who work in the neighbourhood mental health teams, what you'll start to appear is underneath their name on any emails or documents you might receive for them, it will say X neighbourhood mental health team, but it will also specify in brackets which part of the neighbourhood mental health function they're kind of working on when they're working with you. So
Thank you.
Yes, no problem.
Thank you. Thanks, Penny and Martin. So that was a whistle stop tour through what's going on centrally. There really is loads of amazing work happening, but we're going to turn our kind of focus now to what's going on locally. So first up is what's happening in Brighton and Hove, and we've got Mark, who's the General Manager for Brighton and Hove at Sussex Partnership Foundation Trust, and we've got Paul, who's the Team Manager for Employment Support in Brighton and Hove from Southdown. So Mark and Paul, I'm going to hand over to you if that's okay.
Thanks very much, Alice. Yeah, just in a really exciting time. Everything is, on target. So the big ticket item at the moment really is the new electronic patient record and the staff training that's taking place behind that. There's a lot of discussion and communication that's taking place about the electronic patient record. What I think is really positive is that staff who've completed the training are seeing that the system is workable, it's patient friendly, it's staff friendly. So the emergent sort of feedback, I think, is really good about the system. So that is the real big ticket item, getting everybody trained and conversant with the new electronic patient record. Then for us, the next stage is some of this. I'll just give you some sort of bullet points. It's very much around NMHT service users and staff transition into the new sort of teams. It's our central team is ready for November the 10th, but also there's stages before November the 10th in terms of the team coming together. Those things are in plan. We're revising the final sort of primary care communications because, of course, stating the obvious, you know, they're such important partners, and making sure they have all the sort of key contacts and information. And there's something there about those communications. Less is more. It's just making sure that they're very precise and concise for our primary care partners. We're also doing some revisions to the NMHT staff introduction pack. That's something which has had a lot of staff input and feedback. It's had a lot of input from our own working together group, experts by experience. And it's just at that stage really where, and it's a bit like Penny said, actually, I think although we'll have the pack ready, I think it's a pack that will evolve from November the 10th onwards. November the 10th is that really important first step, but actually it will continue to evolve. There's been mention of the standard operating procedure, and I think I would echo what Penny has said, that so much work has gone into it. And I will say my side of the fence, so to speak, or my colours on the mast, whatever these expressions are, I think the standard operating procedure for the NMHT's neighbourhood mental health teams, I think it's really good. I really liked what Penny said. It's likely to evolve, and I really like that idea. I like the idea of if you think of it as a policy, I just like the idea of it being live. And so that what I mean by live is that I think it's really good as is, but I think there'll be opportunities to develop it and change it, because that's what should happen, you know, in practice. So I'm excited about that. And our teams are all on target with mobilizing their meetings. Everything's established really. Our medics are all in place. Yeah, so I feel just really positive about where we are right now, and I'm just very much looking forward to November the 10th. One reason I may feel so positive is I'm just back from holiday as well, so I've still got that positive holiday feeling. And I should open the door for Paul as well. Paul, is there anything I've missed that you'd want to add, or just open the door for you?
Thanks, Mark. So yeah, from the three teams we've met with East Brighton. So last week we had kind of SPFT staff and some of the Southdown managers and staff coming together. So we're just waiting for the invites for West and Central to kind of have those same kind of meetings. I think East are ahead of the other two anyway, but they've started the regular weekly and monthly meetings in-house at the moment, and they're going to expand that to the external partners in October. So we're seeing good progress there. The Southdown staff have been gearing up for System 1 as well. So most of the team now have smart cards and are about to start the training. So we're kind of ready to go from that point of view. Obviously, my interest is mainly around the employment team, and the IPS services across Sussex have been gearing up for this. There's growth built into the national plans for IPS, and we've seen more staff joining all of our teams recently with a view to the neighbourhoods kicking in. And then that growth is built in for the future as well, as we anticipate there will be more referral pathways into the employment teams within the neighbourhoods. So we expect to be working with more people as time goes on and the neighbourhoods become more established.
Fabulous, thank you. For those that might not know, so in Brighton and Hove, Sussex Partnership Foundation Trust work really closely with Southdown as the core team for neighbourhood mental health teams. So it's really great to hear that collaboration. I can see, is it Councillor Sam Parrott has got your hand up? Would you like to ask a question?
No.
No.
Sam, questions are any question is welcome.
No, apologies, sorry.
That's okay. You're more than welcome.
I will
brilliant.
ask when I've got something to ask. Don't worry.
Okay.
Bless you. Thank you.
If it's okay, would it be okay to leave questions and answers to the end so that we can give our presenters a chance to talk through their slides? And Michael, would that be all right to hold that hand? And we'll go through updates for the other areas, and then we'll have time for lots of questions and answers at the end. Mark, Paul, was there anything else you wanted to add from Brighton before we move on to West?
No, not really. Just
All
that
good?
I think there's a positive feel in the air, and I want to, as sort of Penny alluded to, and Martin, there's been so much work building up to this point that, I just think people have, talking for staff, they're really ready for this change, and I think staff understand that this will be, it's a positive and constructive change. So that's it, really. That's the only thing I would add. Thank you.
Fabulous, thank you. Okay, so over in West Sussex, we've got 7 neighbourhood mental health teams, and we've got Fran, for the General Manager for Coastal West Sussex from Sussex Partnership, here to share an update. And I believe our voluntary sector partners in West Sussex, so BHT Sussex, have shared an update with Fran, so we can talk to both areas. Fran, are you there?
Yeah, hi everybody. Thank you for having me today. So there is so much going on that I could talk for quite a long time. So I'll try to keep it brief, because it has been a lot of work getting to this point that we are almost ready to go live. And really, what is the last thing for us really to think about is getting that, as we mentioned, the IPR, the new System 1 training ready. So I think in West Sussex, we have done a lot of work for the last year in terms of establishing the neighborhood mental health meetings. So we have them very well established, and I think currently our next step work around it is trying to use the model that we have for the access and triage neighborhood mental health team meeting for the multi-agency meeting. And this is about the principle. In our access and triage meeting, we have a range of organizations involved. We go adult social care, the third sector, substance misuse, and SPFT. And I think for us is now trying to continue working on that good work around the triage model and how we bring those organizations together into how we expand the multi-agency meetings that we have in the neighborhood mental health teams. So we are starting to see those developments around, starting to talk with Sussex Talking Therapists to see how we can start those discussions of a neighborhood mental health team with patients that are falling between the different mental health provision, and how we can seamlessly transfer one patient from one area to another of the different provision around mental health. So one of the complexities for us has been engaging the GPs. So we have very good progress done in Buerding and Ada, and that model in Buerding has worked particularly well. They have daily huddles with the GPs that basically are used to discuss patients, new referrals, and patients that may be known to the neighborhood mental health team that the GPs have concerns. I think it's about bringing us together to primary care. That is one of the main principles of the neighborhood mental health meeting, and those relationships with the GPs are paramount. So that is the work that at the moment we are trying to extend to other neighborhood mental health teams. So Chichester, which also as Buerding has a high level of referrals, and it's important that we are able to establish that joint work with the GPs, are going to trial. We have started to meet with the GPs, and we are trialing a similar model with daily huddles or 3 or 4 times huddles during the week, where GPs can come in and tell us exactly these are the areas of difficulty. So, I mean, those are ongoing programs of development around the neighborhood mental health team model that we will continue, but we are now perfectioning. It's just a question about how do we engage all the parts and create that joint and collaborative work. In terms of our operational delivery group, we used to have two meetings in West Sussex. We have reviewed and aligned and merged our internal and the joint West Sussex operational delivery group into one. So that helped us just for the service managers, the general managers from SPFT, the voluntary sector, and Sussex Talking Therapies and the ICB to come together into one meeting instead of having different meetings and different ways of communicating. We are coming together into one, so that is going live from the 1st of October. So we all coming together just to look at the implementation and really the detail about what are the areas that we need to work. For example, are we communicating well with the patients? Is there any area that is not clear? And that coming all together has been really, really helpful. I think one of the areas that we are struggling a little bit more is how do we engage with adult social care as well. So there are some thoughts about how we can start to do that. And for example, in Chichester, they are considering in that GP meeting bringing adult social care alongside. So those conversations have started. One of the areas that we are working as well is to integrate the group treatment service into the neighborhood mental health teams. That is a group treatment in Ada, Aaron, and Worthing. So a lot of work is happening there to bring that provision of group treatment into the neighborhood mental health teams. So we are developing like a blueprint in Ada, Aaron, and Worthing, and the aim is to establish a group provision that then we can implement in the rest of West Sussex neighborhood mental health teams. So each neighborhood mental health team will have a menu of group treatment. And I think as it being mentioned, the rollout of the new EPR is currently the kind of the complexity for us. We are talking with the teams to establish the training, protected time, and as well, we have super users that will help on the launch day to support those teams to work through the complexities of the new system. We also have a smart card leads, so we have access to the readers and we can help staff to set up the pins, to just all of that practicalities that can be quite difficult to get the smart card. In terms of the VCSC in West Sussex, as mentioned, Emma Logie is our transformation lead for BHT. She couldn't be here today, but basically there has been a delay in the contract, but that has now been awarded to BHT, and they will be the lead provider in West Sussex. Mobilization of BCSC staff has already started, and they are aligning themselves with the different neighborhood mental health teams. In West Sussex, all of the VCSC mental health contract is part of the core neighborhood mental health team. So hopefully that also helps us to create more of an integrated way of working with the voluntary sector. So if there are any particular queries around the VCSC, Emma Logie is not here, but she can respond to any queries by email. So I think I have that's in the main areas. So
fabulous. Yeah. Thanks so much, Fran. Once presentations are finished, I'll drop a link to an article that NHS Sussex have shared just today about the recommissioning of VCSC mental health support services across Sussex, with BHT Sussex being awarded the lead provider in West Sussex, with the contract starting on the 1st of December, which might be of interest. But thanks so much, Fran. You did a sterling job kind of sharing that update solo, so thank you. Okay, we'll move on to East Sussex. So we've got Ian from East Sussex County Council, who's Programme Manager for Mental Health Integration. We've got Ricky, who is an East Sussex Lived Experience Facilitator from Possibility People. And we've got Glenn, who's a General Manager for, I'm sure it's, is it Hastings, Wealdon and Lewis Havens from Sussex Partnership. So I'll hand over to the three of you to provide an update for East Sussex neighbourhood mental health teams. Are you there?
Yeah, would you like to go first, Ricky? Oh, go on then, you smooth talker.
I insist.
So hello everyone, my name's Ricky. I'm the lived experience facilitator for a charity called Possibility People, and I facilitate the lived experience advisory group in East Sussex. So we call ourselves the League. Possibility People facilitate a league in East Sussex and in Brighton and Hove. And in West Sussex, the Lived Experience Advisory Group is facilitated by Capital, doing an amazing job over in West Sussex. So the reason they asked me to come today was to talk about how in East Sussex we've had lived experience involved in the neighbourhood mental health teams and attending the operational delivery group. And I'll try and give you a very, very quick snapshot in 4 minutes of what we've been up to. So we're very lucky in East Sussex that we've been able to have 2 of our league members attending the operational delivery groups over the last couple of years. And involved in the whole neighbourhood mental health team process. And in that map, it looks like East Sussex is really small, but there is huge areas of rural East Sussex. And then we've got our towns like Hastings and Eastbourne. And by having 2 league members involved, we were able to hopefully represent those rural areas and those town areas. So it's been really good to have those league members involved. The other thing that people asked me to mention today was around co-production and how in East Sussex we've been working with co-production. And I suppose the best highlight I can give you is the away days that have been done in East Sussex. We've had our lived experience members involved right from the very beginning of planning those away days, or putting together the agendas. We had a manager's away day in January where myself and a league member presented. We had the away day in Hastings, the Hastings away day, where we invited the HVA, the Hastings Voluntary Action, and the Men's Room Hastings and St Leonard's to attend, as well as we did an acronyms quiz. And then for the Lewes away day, we brought a personal story of a client in Lewes to that away day. And it's just been a really good, I think probably one of the best examples of co-production for those away days. So that's a great sort of accolade for what we did in East Sussex. And then in Eastbourne, we had a league member local to Eastbourne who not only attended that away day, but that has led to this person being really heavily involved in the Eastbourne neighbourhood mental health teams and attending a lot of their meetings afterwards. So I know that in other areas of Sussex and beyond, lived experiences, can always be a bit patchy in different areas. But I think in East Sussex, we've been really lucky to have a lot of lived experience plugged into the operational delivery group and in those away days. And I think that's probably my 4 minutes up now. So I'm going to hand over to Ian and Glenn.
Yeah, thanks, Ricky. I'm just going to make 3 key points before I pass over to Ian. So the first point I'd like to make is that we're now fully recruited to our leadership team. We've appointed Hannah Debenham, who has started as the Wilden manager just last week, and we've got all the other service managers are in place in all of our other neighbourhoods now, and all of our team leaders as well. So I think it's going to make it really much easier to mobilise, and we'll see much more progress now. We've got our leadership team. What we're working through now, and this is the second point I'll make, is that we're looking forward to welcoming the primary care mental health practitioners and emotional wellbeing service into our integrated neighbourhood team. So there's lots of work that's been going on with those services in terms of, it's a big change, isn't it? It's a big change for staff. It's there's new referral systems that we are implementing with the new SOP, the new computer system. So it's a lot of work, a lot of organisation to get to this point, and that's the next thing now we're really focusing on. So yeah, lots of progress is being made there. I do share Mark's positivity that he spoke about I also acknowledge that everyone experiences change differently, and that we are managing some anxiety around the changes, excitement, some people who perhaps aren't early implementers getting on board. There's a whole spectrum of people that we are working with. So the last point I'll make before moving on to Ian is something really important that we've been doing is working through the kind of patient and staff transfers, because our boundary changes are quite marked in East Sussex. You can see that Eastbourne has gotten smaller, Wilden has gotten bigger. There's been staff consultations involved with all of that. And inevitably, patients will be receiving their care in different teams from the 10th of November. So we are working with those bespoke plans and thinking about how we can make those transfers to be, the safe and the least disruptive, so people get a sense of contingency, so that, for example, if somebody's receiving care in Eastbourne and they're halfway through that, it would make no sense to transfer that particular case. So we're going to treat everyone, individually, look at all of the patient needs and make particular plans around, when is the right time to transfer people. But from the 10th of November, because the new computer system will be set up, new referrals will be coming into those teams, and we're looking forward to working with new colleagues and patients. I'll hand you over to Ian now. Thank you.
Thanks, Glenn. Good afternoon, everybody. I just to finish off, really, the updates that Ricky and Glenn have shared, just a little bit around some of the work that's been happening locally on implementing the new EPR system, Electronic Patient Record System 1, that Mark spoke about as being a big focus of the work in Brighton. It's also been a lot of focus of our work locally in East Sussex as well over recent weeks. And lots of focus going on and making sure that staff are able to access and are engaging with the training resources. We know locally in East Sussex that some of the take up on the training has been quite low so far, but there's lots of plans in place to support staff to engage with the training and be able to take the time out to complete it, that sort of thing. So we're hopeful that will progress well. I think a message that we wanted to try and get out there around training, if there's any sort of staff or people who manage staff on the webinar today, is that we know some people have been thinking that they might want to delay their training until closer to the time that the system comes online, just so people aren't forgetting perhaps what they've learned on training before they come to use the system. Just want to make sure that everyone is aware that there is a thing called the sandpit that the EPR system team have made available, which is basically like a training system that people can access once they've completed their training, to start have a bit of a play around with the system, get to grips with how it's working. So once you've completed your training, you can go and use that sandpit system as much as you want to keep keep your familiarity with the system. So we really would encourage people to take their training as whenever they can, as soon as they get some availability, and to continue using the sandpit option after that, just to keep their skills up and their familiarity. We know that there's been some difficulties around providing connectivity to the new system for our VCSE partners, but we are expecting a solution on that soon as well, and there will be work to follow from there around making sure that everyone has all the hardware and equipment that they need to access the system if they're not an NHS partner. So lots of work around EPR, and I think more and just as positively, I think again in terms of what Mark and Fran have said around getting our neighbourhood mental health team meetings established. We've done a lot of work on that over the last few months, and in East Sussex we've now got all of our meetings established across all of our separate teams, which is fantastic, and they've been being really well attended so far in many instances by a range of partners, which is great. In Wilden, we don't yet have our meetings set up. It's the only team that we haven't got a meeting set up with yet. As Glenn mentioned earlier, the new service manager has just been recruited into post, and now we have Hannah on board. The focus of our next few weeks is going to be making sure that we get those meetings up and running in the Wilden area to match the rest of our patch in East Sussex. So yeah, lots of work. I mean, it's great that we've had Ricky and Richard and Jeff from a lived experience point of view really helping us along the way from start to finish on this. That's been fantastic, and yeah, there's been a whole lot of work, whole lot of positivity, as others have said, and yeah, we'll be carrying on in the next few weeks to get to November the 10th. I think that's it from East Sussex.
Fabulous. Thanks so much, Ian, Ricky and Glenn. It was really great to hear from all of you, but Ricky as well, thank you so much for joining. It's really great to hear about that kind of lived experience input. And we had Tasha Bearfield from Possibility People join us at one of these seminars a couple of months ago and talked about lived experience, co-production and involvement that's happening across the whole of Sussex. So if you did want to catch up with what Tasha had to say about that, do check our YouTube playlist. I'll pop a link in the chat and you can hear what's going on across the whole of Sussex. We've got time for kind of questions and discussion now. I'll end the slideshow and stop sharing so that we can see each other, and then we'll take some questions. Bear with me. Okay, so Michael.
Good day to you all. Two questions I wanted to ask. One was, I know we're really used to talking to each other over Teams and, having virtual working locations. I still think it's really important to actually have physical meetings and locations that people can gel as a team instead of going, oh, we're a team. I've as yet to hear of any specific locations, specifically in Brighton and Hove, as to where those are likely to be. And the other question I wanted to ask, and it's more an observation, I think people in the NHS have got quite used to System 1, but then to start to expect people outside of the NHS, I mean specifically VCSE people, it may be great to have physical access to it, but then you need some time and training to actually get your head around what that system offers and where you're permitted to engage, because not all information should be freely available to everyone.
Thank you.
Thank you.
Thanks, Michael. I'll hand over to Paul and Mark around Brighton and Hove in-person meetings. I know that they've had a great in-person development day and what might be coming up. And then maybe Martin, you might want to come in and just talk about all the training and support that's going on with VCSE partners to support them to kind of use the online electronic patient records. So Mark and Paul first.
Yeah, I mean, first of all, I'd say thank you, Michael, for raising those questions. And do you know what? To give you absolute credit, you always ask, I think, really incisive questions. And so the first point you've raised about teams coming together, basically, I 100% agree with you. And the thinking that's gone behind how we have the team bases, if we imagine Brighton from above, moving across Brighton, even though it's quite small, it can present all sorts of practical difficulties. Getting across town sometimes can take considerable time. So what we have is for the central team, but they will be based at Millview Hospital. What's really important to me is that they'll also be working alongside the West team. So I think that is very important about their shared spaces, That's important for things like, teaching sessions, clinical learning sessions, the ability to be able to use spaces for meetings face to face, both with people that we provide services to, but also for staff supervision and things of that nature. So I 100% agree with you, Michael, about the importance of having that space. The other thing I'd add is I'm really open and supportive of our staff being able to use our bases quite flexibly. So even though somebody, for example, might be based, say at Millview, they might have the need to, or it might be more convenient to meet a person who's receiving services, say, for example, at East Brighton Community Mental Health Centre. And I'm totally open to that. And also would want to see us using other community spaces into the future far more sort of flexibly. You're absolutely right also, and I think this is what Alice was hinting at, about the teams coming together. And all of those things are in train. And I do think I don't feel the need to sort of micromanage it or overmanage it, because the team, I'm comfortable that the teams are coming together. And sometimes that it's important that that has a purpose, but it's also that relational thing about just people getting to know each other. That will also, of course, happen day to day in, the meetings. But I do agree with you about how important that is, and especially for just problem solving and support and being able to tap into, when I worked in the community mental health teams, I know that's old money, but when I used to work in the community teams, I used to really value being able to go and speak to colleagues and, what do I do about this, and just share ideas and things like that. The other point that you made, I think, is very, very important, and it's very important to me, and it's about our staff being confident to use the new system. And when I say staff, I include everyone who's using that. But the point you made, Michael, I think is very relevant around our VCSE colleagues. Now, I feel confident because they're having the same training and exposure and practice as everybody. But I think your point's well made about I recognize that people have different learning styles and take on systems in different ways, so that you've got the training, but some people need more practice, some people need the visual guides to remind them what you do, and so on and so forth. So I would just assure you that we will be ensuring and checking that everyone's confident, that they know what they're doing. There is individual support. There are, champions, floor walkers, all that sort of stuff in place. But it's creating that open culture and atmosphere so that people feel confident to say, I get it, but not necessarily 100%. I need a bit of extra time. And that's absolutely fine, because, as I said, people have very different learning styles. Some people get it just like that. Sometimes people need a bit longer. But thank you for those points, because they're very, very relevant. Thank you.
Thanks, Mark. I think Mark really responded quite well to the VCSE EPR training. But Martin, is there anything you'd like to add before I take some more questions?
No, I think it was just probably more around the estates, actually, because I think just wanted to reassure Michael that there's still the same amount of kind of buildings and people being able to access buildings there was before we kind of started on this program. But there's also a lot of work to thinking actually about. Now we've got different footprints about where those kind of the walk-in areas and where those other services could be in the future as well. But I suppose what's really different, and again, kind of hopefully we're picking up on the kind of the excitement and the opportunities, we can do that as a kind of a shared kind of providers now. So it's not just about the trust buildings or the VCSE buildings. We can start to think about, actually, can we share buildings? And that's what Mark was saying. That's really useful for kind of working in a much more kind of coordinated way for people. If we sit together, we kind of build up kind of sort of really natural kind of interpersonal relationships, as well as systems and processes as well. So that's one of the kind of areas we will be looking for past kind of go live dates, really thinking about our estates and what's on offer, and how available it is and how accessible things are to people as well. So
Fabulous.
Thank you, Michael.
Thank you. Amanda. Oh, you're on mute. Or we can't hear you. Cheryl, are you there? Oh, pop maybe pop the question in the chat, and we can come back to you when sound's working. I know technology fails us at times, so I'll move on to Councillor Sam Powott. You've got your hand up this time with a question.
I have got my hand up this time, absolutely. So thank you for allowing me to come on your call. Obviously, I don't work for the NHS or SPFT, and I've not been a councillor for very long, so I may have some catch up to do. So I'm just really interested in collaboration and co-production, and I'm just curious about what's going on with Brighton and Hove. Obviously, it's really nice to hear from Possibility People and Ricky about what's going on in East Sussex, and I know Possibility People here have been, you know, working with them some. So I'm just curious about what's going on in Brighton and Hove, because I know as a councillor, I've found it quite difficult to access SPFT and to get, you know, information about what's going on. And I know that various parts of the council have struggled to get SPFT representation on some of our boards. The Autism Board is a good example of that, where we've had real issues with trying to get, you know, to find the right people and to make sure there is really good representation. So obviously the success of the neighbourhood mental health teams really rests on you know, really good collaboration and proper co-production, not paying lip service to it. And I'm obviously very curious, given the announcement that's made this morning. I'm aware that the council's relationship maybe with SPFT is not at its finest point. So, you know, I just wanted to, you know, raise that as an issue and say, you know, A, if it's not happening, can somebody please reach out to me and say, how do we get this to happen? And B, you know, or what is happening and where is it happening? Thank you. Sorry if that's quite a long question.
No, Sam, I'm happy to respond.
It's okay. Can I just pop in?
Oh, forgive me.
Sorry, Mark. Before you pop in, it's just because while you were away, I met with Sam and Nikki, which was really helpful. So just a little update is, yeah, so I've reached out to Mark and other colleagues and got a group together that will try and organise to meet with you both to start to have some of those more detailed discussions about Brighton for anything that can't be answered today. So just wanted to let you know, Mark, because I'm mindful that I haven't seen you since you've been back from your leave.
Yeah, and Sam, I would wish to come back to you and I'd say these things. First of all, I think this morning's a perfect example. So let me give you a concrete snapshot that we have what's called a working together group, which is comprised of, you know, people, experts by experience, basically, who use services. So that this, in advance of us going into the NMHT, what the group is doing is they're reviewing every letter that we send to people who use services. I've asked them to use the Changing the Language blueprint, which basically in plain language is just making sure that every letter that we send out is kind of patient-centered. So that's an example, I would say, Sam, of direct patient involvement in looking at every letter to make sure that they're patient-friendly, person-friendly. Every letter. So that's all of our what we call our standard sort of letters. And to me, that's really important to make sure that happens, so that when people receive communications, both electronically and you know, the old-fashioned snail mail, that these letters are sensitive letters, that they're thoughtful letters. But it's all right me saying that, but you need experts by experience to say, hold on a minute, what about that word? What about assessment? What does that mean to somebody when they receive a letter of that nature? And secondly, Sam, I would gently disagree with you about the relationship between Brighton and Hove Council and SPFT, because from my perspective, we work under what's called a Section 75 arrangement, which is hardwired into the Health and Social Care Act. And what that means in plain language is that we have integrated teams. So in other words, we have all of our NMHTs have a combination of SPFT and you know, council staff. Now, the reason that's important to me is because it's about patient care. Because my perspective, leading and managing these services, is that by having those integrated teams, I think that's best for patients, because it means if a person needs, for example, a Care Act assessment or something like that, we don't have to refer into different agencies or groups. We can provide everything a person needs from within our own teams. And Sam, I'm not ever going to pretend that the relationships that there aren't tensions around issues relating to, you know, lots of things. But I'm just making that point to you, Sam, that I do believe actually that these services under that Section 75 arrangement work very, very well for the people that we serve. That's the most important thing to me. The only other thing I'd add is just around that we do have peer roles in the community. So that's people who are working in our community teams, but also who have experience of using our services. And if I'm honest with you, Sam, my perspective is we don't have enough of them. I'd wish to increase their numbers hugely if I could, but we'll stray into other territory there about sort of money and resources. All I am saying though is that they're really important roles, because it's individuals who've used services, they're part of our neighbourhood teams, and I think their contributions, both to direct patient care, but also just what they bring, is something and I know the teams value enormously. Yeah, I hope that sort of responds to the points that you've raised.
Thanks, Mark. And it sounds like there'll be ongoing conversation with you, Sam, and Penny and Mark. Fran, we've got a question from Amanda in the chat around kind of housing linked into West Sussex NMHTs. I wondered if you could respond in the chat to that, and I could take a virtual hand from Nikki, because I am aware that we're running a bit out of time and want to try and get to everyone. Thanks, Fran. And Nikki, over to you.
Hello, hi. Yes, so Nikki Lowe, I'm mum and carer of an late diagnosed autistic adult after a significant wait on the SPFT diagnostic waiting list. He has been somebody who, after 12 months wait, did receive access to lead practitioner roles. I would beg to differ with Mark. That actually I don't think the integrated teams work well. I think he's got his headphones off, so he might not hear me. Yeah, so Mark, I'm mum and carer to an late diagnosed autistic adult who has experienced ATS services, and I would say they don't. The team he had a lead practitioner in didn't operate well as an integrated service. There were a lot of handoffs. I think there's an awful lot of work to be done in terms of delivering a more prevention-based model. I think the risk-based approach to when somebody can access care really does not work for the late diagnosed autistic adult population whose needs have been unmet for significant length of time. And I would say, as a member of the Brighton Hove Autism Partnership Board, we have been asking for SPFT representation on that board, which has not, after 2 years, appeared. So, you know, with all due respect, Mark, I know you're talking from a operational point of view. I'm talking from the point of view of mum of an autistic adult who has ended up in the end being sectioned under the Mental Health Act because of a failure of prevention-based services.
Thank you, Nikki, for kind of sharing your kind of personal experience. Is there anything you'd like to respond, Mark?
Yes, Nikki, I would say that what I would share with you is I don't think that the way our services are constructed around autism I think we've got a long way to go, definitely. I think that's just an honest, open and transparent answer to what you've said. I could give you a company answer, which is we have the neurobehavioral service, which does do a lot of assessments for, as you said, individuals who are adults with any sort of neurodivergent presentations. But let's be straight with each other. It's a service that has a lengthy waiting list. And I do think we need to evolve and change how we work with autism. You said something very important about prevention. And this is my open, honest, transparent view about prevention. I think the services, mental health services for many years have been very focused on risk, quite rightly so. But I think they've also neglected prevention work. Now, with the introduction of the neighbourhood mental health teams, I believe there will be more opportunities to focus on preventative work. An emerging example of that is how we're working with the integrated neighbourhood teams and considering how mental health staff will work in community settings, away from what you would call the old traditional sort of, hospital sites and things like that, and much more focus on primary care. What I'm not going to say to you, Nikki, is I'm not going to make you any rash promises, and I'm not going to overstate how fast this work will happen. But I do actually agree with you that I think the offer for individuals with autism, I think, needs to develop nationally, but I think it definitely needs to develop locally. And the autism board point that you've raised, I will pick up, because I'm not sure I would be the best person to go to that board, but if it's felt that there's a big gap from SPFT, we need to close that gap. But I need to give some thought and consideration to some of our senior lead staff about who would be the right person to be alongside that group. But Nikki, thank you for raising the points. And I just at a human level, within what you've raised, if I try and put myself in your shoes, I can sense the challenges you will have encountered, and how difficult and frustrating that will have been. And we're talking about, obviously, maybe one of the most important people in your life. So I just want to recognize that. Thank you.
Thanks, Mark. We've actually gone over 1 o'clock, but I know we've got hands up. Could I ask for you to pop your questions in the chat, and I promise we'll respond to them. I'll also put our email address in the chat. So if anyone's got any further questions or comments, please do drop a line to the Central kind of Transformation team, and we always respond to those. As always, it's been a really kind of lively discussion, and I really appreciate you kind of giving your time and kind of candid observations. So thank you, and hope to see you at the next one. I'm sorry we didn't get round to asking for everyone's questions, but please do pop them in the chat, and have a lovely rest of the day. Thanks, everyone. Take care.
Thank you.
Bye.
Thank
Bye.
you all.
Bye.